H1N1 influenza cases, commonly referred to as swine flu, are on the rise in India as more than 1,300 cases have been reported in the national capital, New Delhi. The number of cases have reportedly risen by almost six-fold as compared to the same period last year, where 229 cases had been reported in New Delhi. Doctors say that most H1N1 infections are generally mild, with fever typically subsiding in 3 to 5 days. But they've also cautioned that elderly people and children with diabetes and heart diseases are at a risk of developing complications. According to AIIMS, influenza cases have been on the rise owing to a drop in temperature in the ongoing monsoon season. Some of the common symptoms include sore throat, nasal discharge, dry cough, and headache. It added that patients diagnosed with H1N1 virus must isolate themselves at their houses for 2 to 3 days. The institute has also urged patients to use a face mask. Now the question is, what is the difference between seasonal flu and the H1N1 influenza? According to CDC, a seasonal flu is a common respiratory infection that is caused by influenza viruses that circulate every year. It spreads easily from person to person through droplets when a person sneezes, coughs, or talks, while a swine flu is caused by the H1N1 strain of the influenza, a virus. Unlike seasonal flu, the virus spreads from pigs to humans and does not follow a predictable yearly pattern. Meanwhile, the government has issued an advisory that contains a list of do's and don'ts for the general public. Under the do's, people have been advised to cover their mouth and nose with a handkerchief or tissue while coughing or sneezing. The advisory has urged people to wash hands regularly with soap and water or use alcohol-based hand gel. The advisory has also advised people to not touch their eyes, nose or mouth and avoid visiting crowded places. It also goes on to urge citizens to maintain an arm's length distance with those affected, while also recommending adequate rest, sleep and nutrition. Under the don'ts, citizens have been advised to avoid shaking hands or hug people while greeting. The government also advised people to avoid taking medicines without consulting a physician. The advisory has urged citizens to avoid visiting relatives and friends while symptomatic, and that those affected have been advised to visit their nearest medical center if their conditions worsen. These include high fever, difficulty in breathing, bluish discoloration of skin or lips, or blood in sputum.